post-COVID, the EU recognized that there were lots of disruptions in supply chain. And so one of the things they want to work with countries on is how do you situate supply chain or manufacturing capacity in different regions of the world. So ourselves and Barbados would have spoken to the EU. President Ali, Prime Minister Motley would have spoken to the President of the EU, and they came up with an agreement where funding from the EU can come to the Caribbean to help build manufacturing capacity. So one of the MOUs that we'll be signing while the Director General is here would be to start a life sciences hub. Basically what we'll be able to do there is lots of research, develop our research capability to look at drug discovery. We have a large biodiversity in this country that we don't know all the things that are there. And so we want to explore that to see whether we can discover new products, a new way of doing things. So we'll have discovery labs that would be here in Guyana. And we also have been working with a number of partners who have indicated an interest in setting up manufacturing plants here for pharmaceuticals. So that would be another component of it. We are also exploring partnerships to do diagnostic testing and equipment and gadgets to do testing. So that would also be explored. And we are also looking at manufacturing of devices. So all of this, when you combine it, it's going to create a new ecosystem, and where we'll be able to manufacture new products, create new jobs, and of course these things would be very helpful to people with various conditions. So we want to, in a way, start being more self-sufficient in some of these areas. And the other MOU that we'll be signing has to do with capacity building. So we have the French aid agency, and they have a representative now in Guyana. That person is located within the Ministry of Health. And they would be working with us to bring European universities, academic centers, closer to Guyana and our institutions. We would be bringing their experts to train people here. We'll be sending our locals to be trained in the EU. And we feel that by having these types of exchanges, that it would help to lift the quality of medicine that we are practicing.